In this video lesson, we'll be covering a nurse care plan for the nursing diagnosis of risk for unstable blood glucose. We'll cover its definition, defining characteristics, related factors, expected outcomes, ongoing assessments, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing risk for unstable blood glucose. Risk for unstable blood glucose can arise due to several factors, including inadequate insulin production or secretion, impaired glucose metabolism, inconsistent dietary intake or patterns, stress, use of medications like corticosteroids, inadequate knowledge about diabetes management, sedentary lifestyle or lack of physical activity, and acute illnesses, infections, or surgical interventions. While risk for diagnoses do not have defining characteristics per se, early indicators may include variability in blood glucose readings, symptoms of hyperglycemia, symptoms of hypoglycemia, and poor adherence to prescribed dietary or medication regimens. Now we will go over the common expected outcomes, which are the following. The patient will maintain blood glucose levels within the target range, demonstrate understanding of dietary, medication, and lifestyle modifications, report minimal to no episodes of hyperglycemia or hypoglycemia, show improvement in lab results such as HbA1c, fasting glucose, or postprandial glucose levels. Okay, now let's go over ongoing assessments and why they are done. Starting with the first one, which is to monitor blood glucose levels regularly, as ordered. Frequent monitoring provides real-time data on glucose fluctuations and helps identify trends that may require intervention. Next is to assess the patient's dietary intake and adherence to nutritional plans. Understanding the patient's nutritional habits can identify inconsistencies that contribute to unstable glucose levels and provide opportunities for education. Next is to observe for signs and symptoms of hypo or hyperglycemia. Early recognition of these symptoms allows for prompt intervention, preventing complications such as diabetic ketoacidosis or severe hypoglycemia. Therapeutic interventions are the following. Educate the patient about the importance of adhering to their medication regimen, including insulin or oral hypoglycemics. Patient education enhances understanding of how medications help control blood glucose and emphasizes adherence to avoid fluctuations. Collaborate with a dietitian to develop an individualized meal plan. A tailored meal plan ensures proper carbohydrate intake and helps stabilize blood glucose levels throughout the day. Encourage and support regular physical activity appropriate for the patient's condition. Exercise improves insulin sensitivity and promotes glucose uptake by muscle cells, aiding in blood sugar control. Addressing the risk for unstable blood glucose is a multifaceted process requiring continuous monitoring, patient education, and individualized interventions. By implementing these nursing actions and interventions, we can help patients achieve better glucose control and improve their overall health outcomes. Well, that ends this video. If you found this episode helpful, don't forget to leave a like, a comment, and subscribe for more nursing care plans and study tools.